Okay. Good evening, everyone. It's so exciting to be joined for our webinar this evening by Dr. Shriver. Dr. Shriver is, I don't even know where to start. She has done so many amazing things. And the more I read into the book, the more I learned about the amazing contributions she's made to science and to our understanding of so much that we didn't even realize. Even, for example, the work she's done in cystic fibrosis research in non-Caucasian populations, which for us in South Africa, we know to be so important as we deal with such a vast array of patients. But Dr. Shriver is a certified lifestyle medicine physician who is exceptionally passionate about science and education, and really the ideal of making well-being for everybody. Her latest book, On the Path of Health, Wellbeing, and Fulfillment to Your Health, investigates what we think we know about healthy living, as well as reveals the influences on our understanding of health information. And I have to add, it adds so much more understanding to what we think we know about clinical trials and the world around us and the information we're getting. Her book is using complete science to guide the readers to health and happiness by understanding the causes of disease and improving our own well-being. Dr. Shriver is not just all of these amazing things, a certified lifestyle medicine physician and author. She's a certified clinical pathologist and molecular geneticist. She worked for many years at Stanford University and is still an adjunct clinical professor of pathology there. So we are exceptionally honored, in truth, to be joined by her this evening and cannot wait to learn more from her in her talk tonight. Sorry, one thing, before we start the talk, please keep your questions, post them in the Q&A. There will be time to get answers after the talk.
Well, then you need to know how you can. Let's talk about the science of health and wellness. And I'll begin with a question. Do you want to live as long as possible while feeling as well as possible? Well, then you need to know how you can support your health and happiness. You need to know what's for real. There's a fountain of information about health and well-being, and our sources of information often contradict each other. And there is so much to wade through, right? Unfortunately, science is a great tool to separate fact from fiction. And to highlight that in the context of lifestyle medicine, I investigated the scientific basis of what we think we know about healthy living. And in this presentation, I will show you some of what we know today based on that science. Now, health and happiness are influenced by many things. There are the things that we choose, as well as our circumstances, of course, and outside influences. We often don't even realize that we're influenced or manipulated. And that's true for patients, but also for healthcare professionals. The question is, are you going to be taken on a roller coaster ride, or are you going to be in the driver's seat as much as possible? Let me show you why I am so passionate about that. We'll start by having a look at the state of health and happiness in the US today. This is where I live and practice, but these trends apply widely in ever larger segments of the globe. Now, here's some information sourced from the CDC, the Centers for Disease Control and Prevention, about chronic disease in the US. And it's all put together very nicely by the American College of Lifestyle Medicine. Here we see that 6 in 10 adults have a chronic disease, and 4 in 10 have more than one. And those chronic diseases include heart disease, diabetes, stroke, Alzheimer's, and around 40% of Americans will be diagnosed with cancer during their lifetimes. Now, we can never prevent all cancers, I'm afraid, but we do know that at least a third of the cancers in the US could be prevented. And that amounts to 340,000 preventable cancers each year. Also, over 1 in 3 people live with pre-diabetes, and the vast majority don't even know that they're on track to developing actual diabetes. And we see more and more diabetes in kids. And now more than 70% of Americans are overweight or obese. Now, these stats have been rising over decades, and the numbers are also rising in the rest of the world. And what are the major causes of death? Well, I chose to show you 2019. The order hasn't really changed in 2020, except of course for the emergence of COVID. And in 2020, it was in place 3 on this list at 10.4% of all deaths. Now, if you were to compare this list to the past century, then you'd notice that acute infectious diseases predominated then, whereas today, we largely see preventable chronic diseases that feature prominently on this list. Now, on the last slide, you saw the top 10 leading causes of death. Now let's look at the leading risk factors for death. It's small here, but the top 5 are dietary risks, smoking, high blood pressure, overweight, and high blood sugar. And at the bottom, you see the 17 risk factors for disability, and they're very similar. All of these risk factors fuel the epidemic of chronic disease. Now, this is the slide that shows you why you should care. In the past century, the primary focus really was on life expectancy. And major strides have been made, as we all know, mostly by reducing early childhood deaths, and that was achieved by better hygiene, clean drinking water, and antibiotics. But this upward trend has not been sustained in recent years. In fact, if current trends continue, then babies born today will live shorter, sicker lives than their parents. So it's not just about lifespan, it's also about health span. And I don't know about you, but my goal is to add years to life and life to years to basically square this curve, right? Just to be healthy, healthy, healthy. And then, of course, we all have to die. But what we see today is that for many people, a decline starts at the green arrow, so early on, and then there's this long trajectory to decline, often ending in a premature death, or at least having a lot of disability. Most of us don't want that. Now, you might say, aren't most of us living a pretty healthy life? And the Mayo Clinic researched the prevalence of a healthy lifestyle in the US, and they defined that by 4 things. Moderate or vigorous exercise for at least 150 minutes a week. That's 30 minutes, 5 days a week. A diet score in the top 40% of the healthy eating index, which I thought was actually really generous. Then a normal body fat percentage, and not smoking. So, pop quiz. What percentage of people lived a healthy lifestyle, do you think? And the answer was less than 3%. How come? Now, according to the CDC, only about 1 in 10 adults meet the guidelines for either fruit or vegetable intake. But in a national survey, about 3/4 of people say that they eat a healthy diet. So there's quite a discrepancy between perception and reality. There is a reason for the acronym of the Standard American Diet, SAD. It's SAD. Which of course begs the question, what are we eating, right? So the total amount of meat consumed in the US has increased by 40% since 1961. And nations across the world are trending upward. And that has a dramatic effect on us as well as our environment. And as there is no planet B, this should be a reason for change to more plant-based eating. But for many people, that is not a main motivator, at least yet. The answer, however, is not that simple. The answer to what we are eating is not as simple as just meat. It's a lot of meat, but it's also a lot of processed food. So our diet is problematic and we are becoming obese. Now, obesity is a risk factor for chronic diseases, disability, and premature death. And the American Medical Association officially recognized obesity as a disease in 2014. Now, on this slide, you see how obesity and diabetes have progressed together over the years, starting in 2004 all the way to 2019. And darker blue is obesity and darker red is diabetes, and purple is both together. So this is a shocking development in just a few years, where you can see that so many people with obesity also have developed diabetes, and that obesity has increased a lot as well. So obesity is an issue not only because of diabetes, but also because it tripled the likelihood of being hospitalized for COVID, and actually is the #1 risk factor for dying from COVID in people younger than 65. And obesity is rising. In the US, more than 42% of adults are now obese, and there is no significant difference between men and women of any age group. So we need to stop shaming and stop blaming and recognize and address all the factors that contribute to this. Now, moving away from nutrition for a moment, let's also ask, are we happy? Almost 1 in 3 people will have a major mental health issue during their lifetime. And more than 1 in 3 Americans feel very lonely. This lack of true connection affects all ages. And of course, it was exacerbated by the pandemic. And that especially occurred in young adults, which I found surprising. Also, when we look at stress, for example, then work and money were the biggest stressors for people. And that was closely followed by health concerns. So work and money was 64% each, and health concerns was 63%. And the perceived stress levels were lowest in adults over 73, while millennials scored the highest. That was interesting too. So how did we get here? Let me give you a crash course. First of all, industrialization caused global changes. We increasingly moved away from rural to urban settings, and you can see that in the image on the left. And then technical progress allowed us to become less active and more sedentary. Food production also became more efficient with machines, pesticides, and genetic modification. And food became so much cheaper to produce. The food industry was able to scale up and created more shelf-stable items. Also, what we consumed changed from natural staple foods to highly processed foods. And these typically have a lot of calories and little nutritional value. And they're also far removed from whole food that is close to nature. So compare the top of this slide to the bottom of this slide, right? That's the difference. And so we arrived at a new abnormal, as I like to call it, and we've started eating edible food-like substances. So here you can think about snacks, soda, ready meals, and many other products actually that are made from substances derived from food, but with little, if any, intact food in them. And they have a lot of salt, sugar, and fat, and they are often supersized. Now, you may not be aware that companies actually hire experienced experts, craveability experts, that's their term, not mine, that make sure that you just cannot resist that perfect crunch and that perfect mix of sweet and savory when you're having that potato chips. So you cannot just stop at one, right? Meat consumption has also increased, as I said, and a lot of that meat is processed. So when you think about that, then that's meat that is salted, cured, fermented, smoked, or in other ways processed. And here I have a little quiz as well. True or false? Just like tobacco and asbestos, meat is a group 1 carcinogen. And the answer is, drum roll, processed meats are carcinogenic to humans. And it's true. Just like tobacco and asbestos, meat is a group 1 carcinogen, primarily for colon cancer and for stomach cancer. Now that sounds alarming, but as a scientist, I also have to add some nuance here, right? So the level of risk associated with smoking is considerably higher. So if you think about lung cancer, for example, the risk is about 20-fold or 2,000% increased. But if you look at processed meat, then the risk is about 18% increased risk in colon cancer per 50 grams or 2 ounces of processed meat increase per day. So there's a difference in degree of risk, but that risk is present. Okay. So Big Pharma also has a role. And before I get going on that, let me say this. We sometimes forget that the pharmaceutical industry has actually had a major positive influence on human lives. In the big picture, prescription drugs have been game-changing. Think about infections, heart disease, diabetes, cancer. All were drastically and dramatically life-limiting only a century ago. But drug therapy is used very broadly today, and 3/4 of doctors' visits end with a prescription. So patients have come to expect it, and physicians are very quick to prescribe. Also, there's overuse of prescription drugs. They have side effects, there may be drug interactions, and they contribute to disease management, but rarely to an actual cure. And then the other thing is that the pharmaceutical industry has deep pockets. And as Dr. Michael Greger says, the broccoli industry does not. So there is a difference there. And one wonders sometimes whether patients are actually still patients or whether they have become customers. Now on the right in this image, there are the metrics of cardiovascular disease as presented by the American Heart Association. And I really like this representation because if you look at the slide, then you can see that the red bars indicate poor control and the smallest red bars are on the right. There we have lots of drugs to help with management and control of total cholesterol, blood pressure, and blood glucose. The largest red bars are those that are related to lifestyle, but that cannot be fixed by just taking a pill. So what you can glean from this table or figure is that there is a gap in our ability to control 4 out of the 7 risk factors for heart disease. And lifestyle modification can help fill that gap, and it can reduce the need for drugs. And then there is the health industry. First of all, there is the health care industry. And if we want to achieve the stated ambitious quintuple aim of improved health outcomes, a better healthcare experience for patients, lower cost, and all of that in an environment of health equity and clinician well-being, well, then I would argue we need a new health ecosystem. We also need better health communication, and we need different patient-doctor interactions. Today, if a patient comes to their physician because they have high cholesterol or that is discovered during the visit, then basically what happens is statins are very quickly prescribed. And the thing is that all the guidelines currently say that one should start with lifestyle changes, lifestyle medicine in action. But physicians are under tremendous time pressure, and they know that patients expect them to prescribe a pill. Patients expect to be given a prescription. So it takes time to establish that rapport, and it takes time to have that conversation. We really need a change in that, because we need to practice medicine based on the current guidelines. And the current guidelines say, make lifestyle changes first. Lifestyle medicine really is one step toward an overhaul of the entire system. And it's a big, important step to a return to science as the driver of healthcare. So patients also need to be empowered to ask, is there an alternative to a prescription? Now, patients do ask that question, is there an alternative? But they do not necessarily ask it in the doctor's office. They often go online, or they're not satisfied by the minimal amount of time their doctor has with them, and then they end up in the health industry. So here we're talking supplements, alternative practices, and the diet of the day, right? And what that looks like often is really more like the spouting fountain of information on the left, rather than the beautiful fountain on the right, and in terms of actual factual knowledge. And of course, social factors also play a role. The social determinants of health are the conditions in which people are born, grow, live, work, and age. And those are determined by how resources, money, and power are distributed. So these are big, big topics, right? Health isn't as simple as making a personal choice. Causes of dis-ease of any kind reach all the way to how healthcare is delivered and to the social fabric of our world. And health disparities, access to care, and sources of information matter, as does education. There really is an anti-science agenda in the world today, and less science education and less factual knowledge leaves people more receptive to bogus health claims. And I think that science has a public relations problem. When I tell people that I'm a scientist, I get a very different response from when I tell people that I am a doctor. And so science is often thought about as difficult or boring, and it happens behind the scenes, and it doesn't get as much media attention. Think about it, right? How many living scientists can you name compared to, for example, how many living actors you know? What I want to tell people, everyone, is you don't have to be a scientist to like science, just like you don't have to be a chef to like good food. What science has given us is the awareness that we are inseparable from nature, that everything is connected, and that we are made of stardust that dates back billions of years. And after all, science has given us electricity and cell phones and microwaves and vaccines and DNA testing and Wikipedia. It's not just cool, it's vital. Without factual knowledge, we are like leaves blowing in the wind. Now, I see knowledge based on science as Harry Potter's defense against the dark arts. It's important because our choices are a mix of rational thought and subconscious influences. And here we think about the things we just know because they stem from our earliest frame of reference. Also shared knowledge, shared knowledge by elders, by people we respect, who do it in good faith, but whose knowledge may not actually reflect fact. And cultural beliefs and practices, and of course, superstition, myth, and folklore. One of those examples is the pseudoscientific notions about health, such as the 8x8 rule. Now, the 8x8 rule says that you need to drink 8 glasses of 8 ounces of water each day. And the specificity and the use of numbers suggests that rigorous scientific research produced this very definitive finding. But nothing is further from the truth. This basically is just a rule that, of course, is not wrong in the sense that good hydration is important, but you could just think about whether you're thirsty and you can look at your urine, and if it's fairly clear, then you know you're fine. You don't need an app for that, and you certainly don't need this very specific rule. Now, biases are also interesting because they complicate the successful correction of false beliefs. And there are several that I can highlight here. There is the negatively biased credulity, which means that information that points to danger is more believable to us and more likely to be remembered and shared. And another one is the illusory truth effect, where repeated statements receive higher truth ratings. So all of that bias is important because it leaves us open to manipulation. And our decisions can be directed, including about health. And that's especially true when we're in a vulnerable state, when we're tired, when we're hungry, or when we're ill. So now you know the state of our health and happiness and how we got there. And next we'll look at the science of health and happiness. Now, why is it science that should inform you? Because where you put your trust can be a matter of life and death. Science helps us connect the dots, and it can reduce the power of baseless claims because we all shape our life by what we think. And that brings me to mind and body. Our mind also affects our body directly. And we know that health approaches that modify the mind and influence the body have been pretty well studied now. Some of this wisdom has come down through the ages, but it's very satisfying that we can now see that some of these things are scientifically supported by numerous studies, including randomized controlled trials. And we now know that some of these approaches are medically useful, cost-effective, and that they have minimal side effects. And they are effective in the treatment of wide-ranging conditions. Now, most of the research has focused on how the mind influences the body, but studies that look at the effect of the body on the mind are emerging as well. Now, when we think about our cells, we think about our human cells, right? We think about our 50 million times a million cells, but your cells are not doing all the work. Really, the microbiome cells are essential workers, and the majority of the cells within our overall human form are not human at all. So especially the microbiome in the gut influences complex processes, and they communicate with other organs, these microbes in the gut, including the brain. And that's really fascinating. So that's a really good example of how the body can influence the mind. And communications between the gut and the brain go back and forth in rapid succession. And it's actually the microbes that are doing much of the calling. And I think that's really cool because bacteria have been known for centuries, a couple of centuries, and these are very recent discoveries. Now, in my book, I describe the story of the Canadian town of Walkerton, which was studied for 8 years after farm runoff contaminated their drinking water and caused acute dysentery in about half the population, and several people died. The study of this town is a prime example of how a disturbed microbiome resulted in long-term physical and mental health effects. So the microbiome is really critical for our health and happiness. And how do we keep it happy? Well, fiber is so important. And we tend to under-consume fiber by quite a lot. then also maintaining a healthy weight is helpful, and also avoiding certain medications. So beware of heartburn medications and avoid antibiotics when they're not necessary. And of course, as we all know, stress less. Now, by making your gut happy, you can improve your health and happiness. But you might still say, so what? I was born with my set of genes and that's that. But I'm here to tell you, as a geneticist, as well as a lifestyle medicine physician, that genes alone do not determine destiny. Genetic information determines less than a quarter of the variation in human lifespan. And actually, until the age of about 70 or 80, lifestyle surpasses genes for health and longevity. And only about a third of your sense of happiness is based on genetics. And I think that's really good news. You can make a positive difference in your well-being in any phase of life. So let's look at the positive impact of lifestyle changes. And let me use heart disease as one example. So I'll give you examples of a large body of evidence of preventing, treating, and even reversing heart disease. And first up are Swedish men. This was a very large study. In this study, 5 low-risk factors were assessed: a healthy diet, moderate alcohol consumption, not smoking, being physically active, and a normal waist circumference. And the results showed that every additional low-risk behavior reduced the risk for a heart attack. And about 4 out of 5 heart attacks were prevented with a combined low-risk behavior. There is no drug in the world with such proven efficacy. Now here on the left, you see a study by Jenkins and others. And that was the first study to show that diet can be as effective as statins in lowering cholesterol. And the goal of the study was to look at LDL reduction. The result was a change in cholesterol levels down by 30% in 4 weeks. And the same cholesterol control was achieved without side effects of a low-dose statin. So diet can be as effective as statins. On the right, the goal was to look at event-free survival after
So sorry about this. I think owing to load shedding, we've just hit a small glitch. If you can just give us 2 minutes, we're going to fix it now. Really, it's been so interesting so far, and we're all learning so much. So sorry about this. We're going to fix it right now.
for a year. They also had better exercise capacity, and everything was done at lower cost and with fewer hospitalizations. And that was a study by Hambrecht. And then to reversing heart disease. Now, Dr. Caldwell Esselstyn treated cohorts of patients who had run out of treatment options. And he was one of the first doctors who showed that lifestyle changes can not only stop, but actually reverse heart disease. He gave them plant-based nutrition in addition to the usual cardiac care. And he had many patients who followed the treatment over many years, and his recurrent event rate is remarkably low compared to regular cardiac care. There also is the Lifestyle Heart Trial by Dr. Dean Ornish, and he treated two groups. In his group that followed lifestyle intervention, there were no cholesterol-lowering medications, and there was more regression of coronary artery disease after 5 years versus 1 year. So the longer the patients were on this treatment, the better. And the other group had increased stenosis. So these were groundbreaking studies because doctors didn't believe it was possible. And now we finally have developed a good, solid body to support this. And it's not just for heart disease, it's for diabetes too. And for other diseases, this body of knowledge is emerging as well. So on this slide, you see the risk factors for heart disease. But chronic diseases are not separate entities, right? Their risk factors impact one another because they happen inside one body. And what they have in common is that they all lead to chronic inflammation. Now, chronic inflammation is a big underlying problem. Inflammation, as you know, is a reaction of the body to harmful triggers, right? It's a great defense mechanism. And with acute inflammation, like with an infection or an injury, the reaction remains localized. The immune system kicks into higher gear, healing is accomplished, and the reaction ends. But with chronic inflammation, the immune reaction is not local and it lingers. It's a continuing signal that something is wrong. It's also called inflammaging because it causes collateral damage. It causes accelerated aging as well as harm to organs and cells. So if all things are connected, we should have a more comprehensive approach to chronic diseases. Currently, they're often only dealt with one by one as if they were independent, but instead they typically result from a poor overall state of health. Now, we can treat these diseases with drugs, but in many cases you can cut out the middleman, and that's what we're all about. In healthcare, we so often focus on mopping the floor that we forget to turn off the faucet. But we now know that we can use food as medicine beyond the healthy eating for preventing disease. Now, unfortunately, 70% of medical schools in the US fail to meet the minimum recommendation of 25 hours of nutrition education. So many doctors may not even know about nutrition. And that's a shame because it's a missed opportunity. Of course, in the medical specialty of lifestyle medicine, that's different. It primarily uses evidence-based lifestyle changes to prevent, treat, and when used intensively, often reverse disease. And you know the 6 pillars. There's a whole food, plant predominant eating pattern, optimizing physical activity, improving restorative sleep, managing stress with healthy coping strategies, avoidance of risky substances, and forming and maintaining positive social connection. So in lifestyle medicine, the prescription may just happen to be an exercise prescription. Now, I really like the framework of positive health, where you take the 6 pillars of lifestyle medicine and combine them with the concepts of positive psychology. And positive psychology, of course, being the discipline that tries to build what's strong rather than just fixing what's wrong. Now, why is it important? The thing with motivation for behavior change is that motivation can get you going, but you need positive emotions to keep you going, to fuel that car, right? So with positive emotions, you can nourish healthy habits and vice versa. And that way you can increase your physical, mental, social, and emotional well-being. So maybe that should be a seventh pillar, actually, which brings us to the science of happiness. Now, happiness has many definitions and elements, but I think that most people will recognize happiness when they see it. Personally, I always agree with Snoopy's or the Peanuts Gallery's Charles Schulz, who was a great cartoonist. And he basically said, happiness is a warm puppy. And for me, that's certainly true. But of course, it goes beyond that, right? The United Nations identified the pursuit of happiness as a fundamental human goal and right, and declared May 20 as the annual International Day of Happiness. And there are so many elements to happiness: livability, life ability, life results, and life satisfaction. So are health and happiness connected? And the answer is yes. The notion that health and happiness should be intertwined seems intuitively right. But today there's also evidence to back that up. Happiness contributes to health and longevity, although I have to say that unhappy people don't necessarily live shorter lives. And one differentiating factor might well be behavior. People who are happier tend to have better health habits, and vice versa. And happiness has been associated with a reduced risk of chronic inflammation and a lower risk for diseases like stroke and high blood pressure. But happiness, unfortunately, is no guarantee for good health, because there are no guarantees in life, only likelihoods. And that's sometimes difficult for people to understand, that we look at these things on a population scale, like on a population level. And there, that connection is very prominently there. But on a case-by-case basis for any given individual, you cannot really make that link necessarily. But it does change the odds. So what makes us happy? One of the most comprehensive long-term studies on happiness ever was a study of 724 men. And now in their 90s, only about 60 of them are still alive. But the bottom line, after all these years of research of the men, of their families, by questionnaires, lab work, scans, all kinds of investigations, was this: good relationships make happy and healthy lives. They found that social connection is profoundly important, and loneliness is detrimental to happiness, health, and longevity. And another lesson was this: what matters most is not just having relationships, but more importantly, having good relationships. So it's definitely quality over quantity, which is a relief to introverts just as me. Now, does money buy happiness? That's also a question I often get. And the answer is nuanced. The answer is yes and no. Now, it's known that people are more satisfied with their lives when they have a higher income and more education. And an American study in 2010 found that people's happiness increased with income for 2/3 of the population, so not for everyone. And the conclusion of the study was that above a certain level of stable income, happiness is curbed by other factors, like your life circumstances or less available time with family and friends. And research across the world confirms the findings of this study. Now you might ask, what about a hefty raise or winning the lottery? Well, that kind of positive change in income does increase life satisfaction with a temporary increase in happiness. And also, happiness is 30 to 40% genetically determined, and 60 to 70% depends on other factors. So your own happiness baseline, life's conditions, your culture, and yes, money. So what are the happiest nations? I think this is a really fascinating way of looking at the world. In the World Happiness Report of the United Nations in 2022, they looked at a variety of different factors, and the top 5 countries that were the happiest were Finland, Denmark, Iceland, Switzerland, and the Netherlands. And the lowest were Lebanon and Afghanistan. The Happy Planet Index, because it compares countries by how efficiently they are creating long, happy lives using our limited environmental resources. So they're looking to deliver sustainable well-being. And there, the top 5 are Costa Rica, Vanuatu, Colombia, Switzerland, and Ecuador. So I guess if you're in Switzerland, you're golden. With the lowest being Mongolia and Qatar. Now, interestingly, Costa Rica outperformed the US on each of life expectancy, well-being, and environmental sustainability, whereas its gross domestic product per capita is less than half of that of the US. So Costa Ricans actually have higher well-being and on average live longer with a very small footprint compared to the US environmental footprint. All right, so now to your health, happiness, and thriving. Which aspect of your health and well-being can use a boost? It is a very valid question for all of us. And it's especially valid because there are rampant rates of burnout in healthcare. So, considering all of the information we're presented with, let's remember to be discerning. Our perceptions of what leads to wellness and happiness are colored by many cultural influences and at times egregious manipulation. We have to stand up for science, and we have to be true health warriors by protecting ourselves from information overload. And despite some of the negative trends that I presented, I think this is a very exciting time to be alive, with groundbreaking insights into how things work and with bright and meaningful futures for people and, of course, for the discipline of lifestyle medicine as well. So, have courage. You matter. Be well and do well. And above all, live your life. And with that, I would like to thank you for your attention. You can find more about me and my work at lifestyleforhealthandwellness.com, all written together, or you can always feel free to email me at irismd@stanford.edu. And if you're interested in the book, it's On the Path to Health, Wellbeing, and Fulfillment. On the website, there is a discount code for both the hard copy and the paperback, and it's also available as an ebook as a Kindle. So thank you very much, and I'd be happy to answer any questions you might have.
Thank you so much, Dr. Schreiber, for that incredible talk. I mean, I think we all learned so much. And as you said at the end, this generation and the amount of information overload is often very overwhelming. And I think that was a very big thing from COVID. You just never know where to turn. I want to apologize to everyone again. We're very sorry the video cut. Unfortunately, load shedding hit Roxy as she was sharing it. So thank you all so much for your patience and your kindness and giving us a minute to sort that out. We would definitely like to open the floor for any questions. If you feel brave, please turn on your video or your microphone. Otherwise, you're more than welcome to just pop it in the chat. Any questions on Dr. Shriver's work that she spoke about. Otherwise, she really has a vast knowledge on the science of health and well-being. I actually would like to ask her first, while everyone's building up their bravery. Dr. Shriver, what's your advice for us as healthcare workers? You know, you spoke a little bit about burnout, you speak about it in the book. And I think we want to live a healthy life, but sometimes, you know, 32 hours into shifts, all of that, it can get quite overwhelming. So what do you encourage your younger, the people you're mentoring, the doctors, your registrars, what are you currently encouraging them?
Yeah, that's a great question. I think it's so important that burnout is on the radar now, that people are aware that it's not a personal weakness, a personal problem, that it's actually institutionalized. And yes, there is a culture where we as physicians, especially, are just pushing on no matter what, and also expect that from other physicians, but not from other colleagues. So there is a culture change that needs to happen. But studies have actually shown that institutions, if they make changes, that those changes are more impactful than the personal changes any given physician can make themselves. So we really need to look at the big system as well. But on a personal level, I would encourage two things. I always say, when you're overwhelmed, take a break. Even though every fiber of your being says, I don't have time to take a break, even if you just take 10 minutes to breathe or to go outside, you know, nature as medicine, you will be more awake and you will probably get your work done twice as fast in a better mental health state. So that's one thing. And the other thing I like to recommend is digital detox. Because we're so often, you know, with our face in our screens, and that's not the real world, or we feel indispensable. But just turning off the phone for a while, maybe you cannot bring yourself to do it a full day, but just, you know, maybe during dinner or half a day, or just really take that time in a very conscious way. Those two things actually can make a very big difference, because small steps do matter.
Thank you. That's really beautiful, and also almost goes hand in hand, because sometimes the overwhelm is often from these devices and the computers, and they do feel like a constant source of just complete overwhelm. So that is an amazing, amazing advice. Thank you so much. We also have a question from Dr. Dave Glass. So I think, and it is an interesting question, is you started your career and had a beautiful, amazing, incredible career as a pathologist and in clinical genetics and molecular genetics. How did that lead to you becoming interested in lifestyle medicine and that now being your focus?
Yeah, that's a great question. And I understand that it seems somewhat ironic that a pathologist with the focus on disease goes on and eventually writes a book about health and well-being. But I've always had a real interest in that intersect between dis-ease of any kind and well-being. And at some point a few years ago, my husband and I actually together decided to step away from employment at the top of our careers and to pursue a different lifestyle. And we just wanted to pursue new adventures and still remain involved in our respective fields, but step away and have more flexibility. So it was a very positive change for us. And then when I started writing my book, I was doing research and I came across Dr. Michael Greger's book, How Not to Die. And that was actually my introduction to lifestyle medicine. So that was really, really timely. I put the book on the back burner and I thought, this is so important in our world today. There is such urgency for lifestyle medicine in medicine, but also for everyone. that I, as I said, decided to put the book on the back burner and pursued certification in lifestyle medicine. And then I picked up the book again, so that it's really rooted, it's grounded in the principles of lifestyle medicine.
Wow, that's an incredible story. And to you and your husband, I think most of us wish we could be so brave. I can imagine it wasn't an easy decision. But wow, what an amazing one. And I think it shows the research and the science background. But you're right, there's such a need for change on a ground, like a grassroots level. We have one last question. When it comes to applying like yourself as a lifestyle medicine professional, we know that now, we know that there are 6 pillars. But what do you recommend someone can focus on specifically? So it's quite hard, but maybe you could give us, it links to other questions we've had. You spoke about positive psychology, and sometimes I think management, positive psychology aspect to really give information over to patients. Do you have any simple tips or advice around those you think you could share with us?
To give information to patients, yeah, I think positive psychology is really important, because every January 1st people go to the gym, and every March 1st they're not there anymore. So it's just if you don't have the fuel to keep you going through positive emotions, nothing's going to happen long term. So that is really important. And then something that I'm still learning myself when I'm interacting with a patient is that it needs to be a dance. For me as a scientist and as an academic, I just want to share so much information, but the patient may not be ready for that. So baby steps are steps also. And it is really critical to find exactly where the patient is at and what they are willing to change at that time. And then you can build on that. But building slowly is okay. Some people are ready to jump in, and some people really need to take it more slowly because, their family may not be ready, or, they've learned things from childhood to be a certain way. So our role really as any healthcare worker in lifestyle medicine is to support the patients where they are.
That's really amazing advice. And I think, like you're saying, you made a really good point around the family, the communities, and meeting them where they are, even though sometimes it can be frustrating because we want them to do it all. We want them to just be living their best life. And I think sometimes we like their parents. It's like, but we know what's good for you. Why are you being a teenager and not listening to us? So thank you so much for really everything you shared with us today, your talk, your wisdom, your warmth, and just your amazing presence and knowledge. We appreciate it as a small South African Lifestyle Medicine Association so much. And we know that our members and non-members who've joined us have learned so much. And we're hoping to use everything you've shared to grow as individuals, to grow as an organization. Thank you for your time, and thank you for being here.
It's been an honor and a privilege. And for anybody who has questions and didn't get to ask them, please email me. I'd be happy to have more conversation.
That's amazing. And we will share your email address in the comments as well. We've also been very fortunate to be sponsored today by Food Hamper from Soaring Free Superfoods. They are a South African brand who are promoting sustainability. Everything they use and source is non-genetically modified, it is organic, it is sustainable, and they work very closely with all their suppliers. And today they've been honored us with a hamper that we are going to raffle off. So this is a functional food hamper, hand-picked for managing stress. And I think, as Iris mentioned, everyone, Jan 1st feels great, but already March 22nd, I think everyone's already tired and burnt out. So definitely something we need. Supporting better sleep and building a resilient immune system. This hamper will allow you to experience the best of their signature superfoods tailored for a more holistic approach to health. They have picked certain foods that make being healthy convenient, delicious, simple. And because that is their philosophy, they don't want to complicate life when what you really need is simplicity to live your best life. So we have made a little game. Let's hope everyone can see that. Hey, can everyone see our game? Okay. Ta-da! Yay, we have a winner. That's amazing. So, Tilla, we will be in contact with you now to get your details so we can send it to you. But that's really exciting, and we would love feedback on the products as well. So that, because we believe in their brand and think it's really an amazing brand. Thank you everyone so much for joining, and we are so excited to have been able to share with you feedback. Let us email us anything to ourselves, and please feel free to ask Dr. Shriver all her questions. Her email is in the chat box. And thank you for this evening. Have a great evening, everybody.
Thank you. Bye.
Thank you.
Thank you. Bye.